The stomach is a hollow organ in the shape of an elongated sac located on the left side of the upper abdomen. It is approximately 25 centimeters long and 10 centimeters wide, but thanks to its elastic walls, it is able to vary in shape and size depending on the quantity of food present inside it. The stomach belongs to the digestive system, and among the numerous functions it carries out, we find that of storing ingested food, where it is continuously mixed and partially digested, thanks to the chemical action of gastric juices, including hydrochloric acid. However, when a stomach cell begins to multiply uncontrollably, it can give rise to the formation of a tumor mass, which as it increases in size, begins to invade and damage the surrounding tissues. Stomach cancer is the fifth most common cancer in the world, and in 2022, in Italy, approximately 14,700 new diagnoses were estimated, of which 8,800 in men and 5,900 in women. 90% of gastric tumors are adenocarcinomas that originate from the cells of the gastric mucosa that internally lines the organ. The remaining 10% includes soft tissue sarcoma, where the neoplasm usually develops from the muscular layer of the stomach, but also gastrointestinal stromal tumors, which form from the tissues that support the organs of the digestive system. Symptoms of stomach cancer. In the initial stages, the symptoms of stomach cancer are nonspecific and can be confused with those of gastritis, inflammation of the internal wall of the stomach, or a peptic ulcer, lesion, more or less deep, of the internal mucosa of the organ. Among the main symptoms of stomach cancer we find dyspepsia. Dyspepsia, from the Greek bad digestion, indicates an alteration of the digestive functions of the stomach. It can be of a functional nature when it is not due to a lesion or damage to the gastrointestinal system, or of an organic nature when it is due to pathologies of the digestive tract, including esophagitis, gastritis, duodenitis, and a stomach tumor. Dyspepsia is a very common disorder, especially after large meals, high in fat, or fried, or very spicy. However, if it appears suddenly and is particularly bothersome and persists over time, you should have it evaluated by a doctor. The growth of the tumor mass can also cause epigastralgia, that is localized pain in the epigastrium, one of the 9 regions into which the abdominal cavity is conventionally divided. It corresponds to the highest and central area of the abdomen, delimited above by the costal cartilages and below by the umbilical region. Pain localized in this area, that is, the pit of the stomach, may be due to a gastric tumor. Occult blood in stool or vomit. Another of the possible symptoms of stomach cancer is the presence of occult blood in the feces, which however is not visible to the naked eye, but only through specific laboratory tests. A positive result on this important screening test could also be due to a series of more or less serious medical conditions, including diverticulosis, colon polyps, hemorrhoids, gastric ulcer, or colorectal cancer. When the feces take on a black and tarry color, it is called melena, and in most cases it comes from bleeding that originates from the upper part of the gastrointestinal system at the level of the esophagus, stomach, or duodenum. This is digested blood, whose characteristic black color is due to the oxidation of the iron in hemoglobin by gastric juices, digestive enzymes, or the intestinal microbiota. Sometimes melena is associated with hematemesis, medical term used to indicate the emission of blood during vomiting. If the bleeding is severe enough to be expelled with vomiting, before being oxidized by the acidic pH of the stomach, the blood appears bright red. However, if the hemorrhage is prolonged over time and the bleeding is not sufficient to cause vomiting, the blood remains in the stomach for longer. Hemoglobin, in contact with gastric juices, oxidizes and is degraded to hematin, giving the blood a darker color, ranging from brown to black, similar to that of coffee. In fact, we speak of caffeine vomit as the expelled gastric material resembles coffee grounds. Pain and heartburn. The term heartburn refers to a burning sensation, usually found in the pit of the stomach or in the area behind the breastbone, which in some cases can extend to the base of the neck. The Italian National Institute of Health reminds that heartburn, if occasional, for example after a large meal, should not cause concern. On the contrary, if the burning sensation is felt frequently, for example after each meal or several times during the week, it could be a sign of a disorder that requires medical treatment. In the presence of a malignant neoplasm, the production of acid by the stomach increases and those natural defense mechanisms are reduced, thus damaging the protective mucosa that lines the organ and causing a state of inflammation that causes burning or pain. Weight loss. Weight loss, in the medical context, indicates a reduction in body mass caused by a decrease in muscle mass, adipose tissue, or body fluids. Involuntary and unexplained weight loss, which is not caused by a reduction in calorie intake or by physical exercise, is a warning sign that you should always pay attention to. This is a symptom common to many malignant neoplasms, including stomach cancer, and in this case, it is called cancer cachexia, a state of gradual weakening of the organism, accompanied by a feeling of extreme tiredness, drowsiness, loss of appetite, and general malaise. This is because neoplastic cells cause a series of metabolic alterations that have important consequences on the body, including a decrease in appetite and a loss of body weight. The metabolism of cancer cells thus removes nutrients intended for healthy cells in order to obtain a sufficient amount of energy for their growth and reproduction. Feeling of fullness and abdominal bloating. It must have happened to everyone that feel like a brick in your stomach immediately after eating. Stomach heaviness problems usually appear as soon as lunch is over, particularly after very large meals or based on foods that are particularly processed and therefore difficult to digest. It manifests itself with an annoying and prolonged sensation of gastric fullness, often accompanied by gastroesophageal reflux. However, if it occurs with a certain frequency, it could indicate a poor functioning of the digestive process, a disease of the gastrointestinal system, or a malignant neoplasm, including a stomach tumor. In this case, the tumor mass can make the walls of the stomach very rigid and reduce its ability to store food, making you feel a sense of heaviness in the upper part of the abdomen, even after consuming a small meal. Under normal conditions, thanks to the elasticity of the gastric walls, the stomach is able to change its shape and size based on the quantity of food present inside it. Just think that if empty, it has an average capacity of 500 milliliters, while at maximum expansion, it can reach a capacity of 1,000 to 1,500 milliliters. As stomach cancer spreads throughout the body, it can cause an abnormal accumulation of fluids within the abdominal cavity, particularly in the peritoneal cavity. It is a serous membrane that serves both as a lining and protection for the abdominal organs, and as a conduit for the blood and lymphatic vessels and nerves of the abdominal region. A pathological collection of liquid inside the peritoneal cavity causes what is called malignant ascites and is due to the pressure exerted by the tumor mass and the obstruction of the lymphatic vessels, which no longer being able to drain the liquids correctly will begin to accumulate in the abdomen. However, as the Italian Association for Cancer Research points out, it is rare that a single sign or symptom allows unequivocal recognition of the onset of a tumor. Often, they resolve spontaneously in a short time, while in other cases, if they persist, it is important to contact your doctor. In most cases, they are due to some pathologies that tend to heal with the right treatments, but sometimes they can be the indicator of a malignant tumor. An early diagnosis makes it possible to identify a tumor when it is still in its initial stages, increasing the effectiveness of the therapy and, above all, the probability of survival.